Welcome, everyone, to our webinar, The Payer AI Readiness Gap, Why Better Data Will Define the Next Era of Health Plan Performance. Hosted by MedCity and sponsored by Verato. My name is Martin Hogard, General Manager from Verato, and joined today with two other speakers. So let me allow them to introduce themselves. Thomasina, I'll start with you.
Thanks so much, Martin. Hi, everyone. My name is Thomasina Anani. I am the Associate Vice President of Enterprise Analytics with the Alliance of Community Health Plans, and so happy to be here today.
And Mr. Vinay.
Good morning or good afternoon. I'm Vinay Kulkarni, Chief Information Officer at SCAN Health Plan. As one of the nation's largest independent nonprofit Medicare Advantage plans, SCAN roughly serves about 450,000 members across 6 states. Our organization is defined by its mission to keep seniors healthy and independent. SCAN's deeply rooted culture that has landed us in the Fortune 100 Best Companies list for 6 straight years. In my role as CIO, I focus in bridging this incredible care mission with modern AI data-ready infrastructure to better serve our seniors. I'm so excited to be here.
Thank you both. I feel very honored to speak with you both, especially after those intros. All right. So just a quick reminder for the audience, we'll be taking questions at the end, so feel free to put those into the webinar, and we'll be sure to get to those at the end. But let's jump into the questions and let's get the conversation going. Let's start with the overall situation. Thomasina, let's start with you, and then we can pass it over to Vinay. But the question here is, where does data fragmentation create the most friction for health plans today? Is it member experience? And there are many, right? Quality, payment accuracy, provider data, operations, or even AI?
It's a great question, Martin, and I think a great place to start. Before I jump in, I think I'll first frame the perspective that I'm coming with. And so ACHP, or the Alliance of Community Health Plans, we are a member association representing provider-aligned or provider-sponsored community health plans or regional health plans across the nation. We represent over 30, representing about 22 million lives across every line of business. And so I get to speak with chief financial officers, business strategy leaders, CTOs, CIOs. And so I'm coming with a kind of a global perspective, if you will, when we're looking at the regional health plan industry. And so my responses will likely across this webinar reflect that global perspective. That being said, your question is talking about data fragmentation, and I know Vinay will be able to jump into what it's like on the ground. What I think, take this response is in 2 angles, if you will, an external perspective and then also an internal one, just based on what I'm hearing across our health plans. So first, externally, thinking about the plan and then also the provider, and the likely and often the silo or the firewalls that exist when we're thinking about data between these 2 very critical segments of the continuum, if you will, when we think about the care experience of members across the nation. And so provider-aligned health plans specifically do have a structural advantage, if you will, but still face this same friction when we're talking about data fragmentation. And so you mentioned a few areas. I think payment accuracy and risk adjustment is one that that is definitely top of mind for many folks today. But I think really one of the clearest examples when we're thinking about all health plans. Fragmentation shows up as documentation gaps, misdiagnoses, undercoded acuity, depending on who in the health plan industry you're talking about. And of course, leads to whether or not your plan succeeds, if you're being paid accurately for the patients that you're serving. And so if you're not capturing this information accurately, you're not being paid accurately, it's affecting your competitiveness, it's affecting whether or not you can actually thrive in the competitive landscape that is the health plan industry, and you just can't compete well enough. And so the fix isn't just technical in this space. Data must be captured, documented, coded precisely so that payment reflects that population you're actually serving. And I think that's one example from my perspective. Then I'll take an internal perspective when we're thinking about the mechanics of a health plan. And so I think there often is an operational fragmentation that exists as well. And it's the base layer of the problem. and the least discussed, I think, sometimes when I'm talking to some of these health plans. And so two models, or there may be more, exist, but the two prominent models that exist, we have sort of like a analytics centralized or almost as a shared service, right? As a consultant across various functions across the health plans, or we have embedded analytics with across functions. So you may have a finance team that has their own analytics function, a quality team that has their own analytics function, or a pharmacy team that does. Both can work. I'm not going to make a judgment call on either approach, but when data definitions aren't shared across functions, they get inconsistent reporting, leadership making decisions off of different versions of the truth, not to say one is better than the other, but this internal fragmentation, as we're talking about AI readiness during this webinar, you can't build on a foundation where the enterprise isn't speaking the same language. And so before we talk about AI readiness, we have to talk about whether the health plan is operationally ready, and that starts with shared definitions and consistent data governance across functions. But I know Vinay will have a better response here about how this actually works.
Thomasina, thank you. I think you covered a lot of points that anybody in a payer space would agree to that. Data fragmentation is a systematic challenge. It impacts both providers and members, and operationally also, like you covered. While provider data causes the most profound administrative and operational headache, fragmented member and provider data creates the most friction for member experience. And this directly erodes brand trust. You don't have information about me is the question that most members would ask. And sometimes it's a data delay between how the providers and payers exchange data. And data is sometimes isolated in payers and provider system. And the timing when the payers and providers exchange data creates this major friction points for members. It feels like members act like a data integrator. They have to bring data from outside because of how our laws are. Sometimes some people would not know the data of the member, like how we would want to share, but we have to play within those rules also. So this creates a bit of a friction and a member experience that doesn't feel like we know everything. Without real-time and up-to-date data, AI and analytics are not effective either. So it creates a problem for everybody in this matter.
I like that a lot, Vinay, especially, how like we're almost pushing the problem to the member, and they are, as you called it, the data integrator to some extent, right? So let's we'll move the conversation to figuring out what the solution might be. But just before we get there, we kind of coined, all right, so this is the where the areas where we're seeing a lot of fragmentation. But why have so many payer data and analytics investment fail to create the level of progress and trust, I would say, that leaders had originally expected? And Thomasina, I'll start with you on that one.
Yeah, no, it's a great question. And I think one that would give any CIO or CTO some consternation, maybe some heartburn, but it's a good one. But I think I would gently or maybe kindly push back on the word failed, right? There is huge and great promise when we're thinking about the investments made into just good data. And I have to give my kudos and claps to all around to the healthcare industry for really diving in deep here and making great investments in this space. But I don't think those investments have failed. I just don't think the greater promise of data integration, data investment, things actually working well, and folks being able to talk the same language across different data layers, I just think it's not yet fully realized. And so I think the honest answer maybe is that maybe we overinvested maybe somewhat in the technical layer and underinvested in the organizational one that actually enables the technical one to see that full promise. And so when we think about different platforms, maybe cloud infrastructure, analytics, talent, that's all there or getting there. And I think great investment has been made. But what's lagged, and I don't think anyone would disagree, is that interoperability between systems not really fundamentally originally designed to talk to each other, but then also the cultural shift required to actually act on that data rather than just report it, right? So health plans are still in many cases producing beautiful dashboards, but they don't actually change most decisions that are being made on a day-to-day basis. And I think a lot of that frustration is what would lead a leader to say, oh, we spent all this money, why have we not yet seen the ROI, right? And this reminds me of a time about a decade ago. I had the opportunity to attend the first Health Data Palooza, and or one of the first ones. And the conversation was about health information exchange, a careful, deliberate, data forward, at least for the time, but very cautious approach to making data available to researchers specifically for innovation. Fast forward a decade later, I had the opportunity to attend the Consumer Electronics Show Digital Health Forum in Vegas earlier this year, where leaders from the Trump administration on stage were talking about AI and the release of data for innovation in a way that was categorically different. So the shift from careful stewardship to what I'd call maybe careful freedom. And because healthcare is already such a governed industry, this is a window I don't think health plans or the wider industry can afford to miss. So the plans that move now thoughtfully but decisively will define what the health plan of the future looks like. And I believe the opportunity is here. The question is whether our organizational readiness matches our ambition and equally our investment.
I like that answer.
Wow, what a good answer. I mean, I would like to build a little bit on that. I'm not going to spend too much time on this, but I wholeheartedly agree with what you just said. It's also dependent on the question, the previous question. One of the things that is the biggest challenge in healthcare industry is that the data is not there on time, and analytics is supposed to lead us. But if you don't have the data in the right time and the right data, it's very hard to predict something or get an analytic view on it. And many investments, like Thomasina pointed out, that have been on deploying newer tools or platforms without addressing the foundational issue of quality, data quality, and integration. I kind of agree that it's not a failure, but it's also a short-sightedness in how we integrate all the clinical, pharmacy, and social determinants of health data into a single functional analytic engine. That, if we are able to bring that, you will definitely have a better analytical ROI. And it does come, but it takes a longer time in healthcare just because the data is siloed.
Yeah, and maybe Vinay, building on that, just to kind of define like what are we trying to get to, right? So what does AI readiness actually mean for health plans beyond having a cloud platform or analytics team? Like what does that look like?
It actually is a lot of things. I'll try to point some, and I'll take Thomasina's help on that. For a health plan, AI readiness is an operational and a structural reality, not just a technology stack. Having a cloud infrastructure or analytical team simply means that you can store data and build models. It does not mean that your enterprise can actually deploy AI safely, accurately, and cost effectively. AI readiness is more than just infrastructure or talent. It means having high quality, well-governed, and interoperable data, clear and prioritized use cases that work for your organization, and robust data privacy and security practices. It's important to note that you have to build your own use cases. When you copy somebody else's use cases, it doesn't get you the right output that you want. Yes, you'll make some good decisions, but it won't get you what you want. True AI readiness means your data, workflows, and compliance guardrails are built so that your machine learning models and your large language models can rely on that. You've got to have an embedded human in the loop checkpoints. This is have a mandatory manual review gates. And these are structures that you have to put in place. And then finally, I would add that you need to ensure that you have a deterministic data lineage. By that, what I mean by that is that the capability to trace AI-generated output exactly back to its raw data inputs, transformations, and applied business rules. This will help you define a real structure of how you want to get AI in your organization.
Yeah.
Love that. Thomasina?
Yeah, I agree.
I'm sure you have things to add there.
I think Vinay's answer is the crux of the answer. So I'll build on what he said. And I think for the health plan of today, AI readiness isn't just a technology question. It's largely also a governance one. And that's not the most sexy thing folks want to talk about today. And so I'll honor that. However, you have to answer the questions of who really owns the data, right? Who's accountable when the data is not right or the reporting's not right? Who decides what the model is actually optimizing for? You're going to get about 15 different responses when you look at the 15 different health plan functions and departments, right? And so those aren't exactly always IT questions. They're leadership questions, right? And the plans that skip that particular conversation and go straight to deployment or even to experimentation will get a confident wrong answer at scale, if I have to say, right? It'd be a confident one. There would be much money put behind it, but it may not always be the right one or the one closest to the truth. So I don't think governance, it's not a compliance exercise. I think it's really a competitive one. The plans that get this right in the next 2 to 3 years are the ones that will actually deploy AI in a way that moves the needle, begin to realize that ROI sooner than later. And the others will keep buying tools and wondering why nothing quite sticks, unfortunately. But that's my take, I think.
Yeah, I love both those answers. So we've kind of defined maybe a more higher level of like what AI readiness means. If we jump down into a few more specifics underneath that layer, how should payers think about identity across all the different domains that they manage, including members, their providers, even the households that they're trying to kind of create? Then there's also the extended caregivers, their locations that both the providers and the members interact with. And then there's network performance, compliant. I mean, you name it, right? So there are a lot of different pieces to this puzzle as we get one level deeper. Vinay, what are your thoughts on that?
I love this question because, in healthcare industry, it's very unique. Identity is a web of relationships where an individual or an entity like a provider organization constantly changes roles based on context. We as payers have to think about enterprise master person index alongside MDM that most organizations have. Think about simple concepts like provider and even members and caregivers, and to that effect, householding. Householding is a very simple concept, but hard to implement. Financial systems have figured this out. If you apply for a mortgage, they eventually will tell you that somebody in your household has applied for a loan. In that context, if you think about our families who are getting insured, we have to think about members and caregivers. A single member identity must link clearly to their clinical history and their designated legal caregivers or authorized representatives. Similarly, on the providers, provider is just not a single row in a spreadsheet. One provider identity must link out to their physical location or a tax ID and the unique digital health network or endpoints that they have, because each of their how they have relationship with different payers are different. So we have to really map this out in a way that we can uniquely identify a provider at a certain location. So they go in hand. Similarly, on the member side, we have the same concepts for benefits, and for pharmacies, we have the same thing. So it's identity is really an identity crisis within health insurance companies, and we have to make sure that we adopt a EMPI, which is an Enterprise Master Person Index, to be able to identify the same person over the years. And when they come back for insurance, if they leave and then come back, we need to be able to identify that that is the same person. That's our biggest challenge.
Thomasina,
Yeah,
what are your thoughts on this one?
Yeah, thank you. So I'll weigh in here. I love that we're beginning this conversation thinking about that technical architecture that is vital and critical. I'll speak to the fact that I believe that there's a real human cost to getting it wrong. And I want to ground us maybe in what it actually means with a few examples for a member when that data is wrong, right? Exactly to what Vinay just spoke to. Let's take the case of prior auth, right? Fragmented provider data means that prior authorization decisions get made on incomplete information, wrong provider, wrong network status, wrong clinical history. The member ends up paying the price in delays and denials, right? And in today's environment, that frustration doesn't stay private. Or it may be the bill that the member shouldn't have gotten. A member sees a provider listed as in-network, the data says otherwise. They get a bill, and that single moment, entirely a data problem, right? Exactly to what Vinay just spoke to, becomes a trust problem, which Vinay also mentioned earlier when we started. And trust, once lost, is extraordinarily hard to rebuild, especially this day and age. And then sometimes you may have on paper, right, a closed loop, right, a care gap that on paper was actually filled, but was not the experience of the member in reality. So quality metrics show that the gap is closed to an extent. The member's experience tells an entirely different story. That disconnect is exactly what ends up eroding confidence in the health plan over time. And so we do talk about data quality as a technical or financial issue, and I will wholeheartedly agree. I think that's vital and critical to this discussion, but at its core, and I think Vinay really hit on this when we started, it's a trust issue. And right now, trust between the health plans and their members is not something any one of us can really afford to take for granted. And so what is being described as a technical issue very quickly has a real human and material cost when we think about health plan success and member experience.
Yeah. Really appreciate just that wide perspective on that. Thomasina, picking up on kind of the trust piece. So kind of jumping into, now we have kind of the AI readiness defined. We know kind of what the architecture might look within each of the pieces, within each of those domains and the relationships, to Vinay's point. But what is the difference between exchanging more data that can be more data and creating data? So, difference between exchanging more data and creating data that can be trusted and acted on.
Yeah, I think this brings us full circle, honestly, to where we started. So more data without that trusted foundation really isn't quite the asset that it may sound to be. It's noise. It's real noise in the ecosystem of all of our health plans and the wider ecosystem at large, right? I'd say that there's been maybe like a rat race of sorts on when we're talking about data investment, where we started. So what can we implement? What can we collect? What can we code appropriately so that there's data to be able to say something about it? And that instinct is not wrong. I will never say it is. I used to teach stats. I love having all of the different data so that we can optimize models and get closer answers to reality. So I will never deny that that's important. Richer data sources do matter. Social determinants of health data, for example, behavioral health data, aspects of member experience we do not yet have analytical language for. Or I'd say, can folks still hear me?
Yes, we can hear you.
Okay. Apologies. I think my office just turned off, but let me continue going. So that instinct isn't wrong, whether it's all these different pieces where we need to have behavioral health data coded for, aspects of member experience we do not yet have, analytic language for. Those inputs make models more precise and insights more rich, but only if that foundational layer is there. If your data is fragmented and poorly integrated, adding more of it amplifies the problem at scale. And so I feel that more data exchange on top of a broken foundation doesn't accelerate your AI journey. It accelerates your AI risk. And I don't think anyone with all the money being poured into AI today really wants to find that out the hard way. So the plans that will win aren't the ones that collected the most data or was able to provide more analytical language to data not yet coded appropriately for. They're the ones that trusted it enough to act on it well enough.
Vinay, any additional perspective on that one? I think Thomasina said it right. Yeah. When just a volume is considered for data exchange, it just increases the speed at which bad experience perpetuates from your organization and also causes automated mistakes. Is just not a good experience when you just do based on volume. Data has to be exchanged consistently in the right format, good syntax, context, good quality, and actionable data. It can never be a dump and run strategy. It has to be well thought out. Why are we exchanging this data? That's in addition to what Thomasina said.
Yeah, I love that. So we've kind of walked through kind of the situation, the problem, and kind of where's the goalpost. And so maybe we switch to like how they, what is the solution, like next steps on the solution, right? And so Vinay, maybe I'll start with you on this one. How should payer executives prioritize foundational data work when budgets and transformation resources are constrained, like they always are, right?
Yeah, very true. Unfortunately, transformation takes multiple years. When capital is scarce, every project must save dollars immediately. Especially what we are seeing is that there is a increased cost pressure on payers and providers across the board. The prudent thing to do is to commit to funding long-term data work and structure their approach to explicitly tying fixes to immediate high ROI operational use cases. The biggest pain point is in data cleansing, and nobody wants to do the job of cleaning, and it takes a long time. Instead of cleaning your entire historic member database, deploy validation checks at precise points of entry, such as onboarding or live call intakes. Force this for the time being to make it part of your operational software, to verify and standardize identity attributes and make those changes real time. Shifting the data cleansing burden away from a centralized IT budget and into baseline daily operations will give you some relief, and at least it'll start giving you benefit. But all said and done, this is a multi-year project. Every time you take transformation of data, it will take capital dollars. This is just a Band-Aid.
Yeah.
Thomasina, how do you look at prioritizing the foundational data work?
Yeah, I'm so glad Vinay started there. I have a heart for analytics folks, CIOs, CTOs at the health plan, because I'm hearing so many from so many of them every day. And if I were to start my answer to this question, I'd say I want those folks to please be kinder to yourself. And the reason why I'm saying that is because exactly what Vinay said. I think there's an underappreciation from non-technical folks, and I'll just say it because I think I can from my vantage point, on the fact that it is a multi-year investment. We talked about, like the promise or the failure and not yet seeing ROI just yet. And I think it's because not everyone fully understands that the underwork required to get to a place where the promise is finally realized. I think gentleness from these leaders, technical leaders in these organizations. And when I say gentleness, I mean, as you're talking about those multi-year investments, let folks realize, when we say data cleaning, it's going to take a year plus or whatever, however many years, right? When we say these various stages where there's an inherent lack of appreciation for, because folks truly don't understand the nature of the work required to get it right, that foundational layer right. I think building that in, whether it's from the operations team, higher C-suite team, where no, this is what it takes, this is the amount of time it takes, amount of budget it takes, the number of resources it takes to get this right. And I think sometimes we get excited about what we know we can do with the investment, where we speak more about the promise than the work that it requires to get there. And so that's what I mean. I think a lot of our technical leaders in this industry should be kinder in the way that they stage what that promise looks like when finally realized, but then also the process by which it actually can happen.
Yeah. Love that. And as we come up kind of to the end of this webinar, I want to leave the audience with kind of practical next steps, like what to do from here, right? So Vinay, let's bring it back to you to start with. But what are practical next steps that health plans can take in the next 12 to 18 months to improve data trust and AI readiness?
I want to go back to what Thomasina had brought up in one of the questions. The two-truth metric problem. Essentially, one organization may have data in a different way, and the other one has in a different, or even it could be between two different departments, and they could be having data that could be conflicting. And that's one of the big challenges, eliminating two truths, because of the timing of the data that we have across the board. We have to start thinking about building a unified semantic translation layer, which is basically helping you to clean or build the right data infrastructure underneath that, while your experience layer being able to connect with your semantic layer, or your analytics layer able to connect with the semantic layer. We have to stop the constant flow of broken, dirty data into your central data store system, whatever it could be, analytics or the operational data store. That, to me, is a right step, where you are bringing in a unified semantic layer, translation layer on top of your data. And one more thing I want to add there is the data governance team has to be reimagined. It has to bring in a little more of a business perspective, and get your CFO, get your CEO, and everybody involved in that. It's no longer just an IT data governance team.
Love that. Thomasina?
Love that. And so I'll tackle this. I want to be clear about the assumption that I'm making up front. And it's what we've been speaking to throughout, is that foundational data work is done or underway, as I'm thinking about what the health plan of today, how they prepare in the next 12 to 18 months for the health plan of tomorrow, right? And I do want to recognize that's a stretch for many plans. But let's talk about what's possible when you're ready to innovate on top of it. of that foundational layer. I think many plans need to build a roadmap and put AI at the top. There's been so much market disruption by line of business, driven by policy changes. We've been seeing retrenchment across the nation, where plans are exiting certain markets. It's actually an opportune moment to step back and get strategic for plans that haven't already gotten strategic. So what is your organization's ethos on AI, right? It's going to differ depending on the kind of plan you are and who you serve. Is it enterprise transformation you're thinking of? Are you identifying top 2 or 3 functions where AI would deliver immediate ROI, that low-hanging fruit? I think that question has to be answered before you buy another tool or try to build something. You have to know where you're going and what your North Star is. And I think for many plans, at least for the regional ones I'm speaking to on a day-to-day basis, you have to start with operations, I think. For most health plans, especially as administrative expense ratios tighten, operations is your best bet for that low-hanging fruit. Where can AI start to reduce friction, reduce manual work, and show a return quickly? That's where, if I were in those shoes, that's where I'd start. And I think many plans should pick 2 or 3 and go deep, not wide, if you want to withstand, that time frame. So don't try to do everything. Don't deploy a whole bunch of point solutions just because you have maybe budget to do so. Identify the functions where the data foundation is the strongest and that ROI case is the clearest. Go deep there first, prove that it works, then expand, go to scale after. But I think, again, the time is now. The window's open. I think the policy environment is more permissive than it's ever been in the last decade, if my read on it is right. And the plans that build that roadmap now and start to invest thoughtfully, I think with governance at the center, are the ones that will define what comes next and show that they did it and did it right.
Love that answer, Thomasina, especially the point about going deep, right? Because you'll truly learn so much by fully going through with an entire project rather than just, spreading it thin and not necessarily taking it till the end. I want to thank you both so much as our AI readiness experts. Thomasina, Vinay, it has just been great to hear your perspective throughout our time here. So thank you, and thank you for the audience dialing in, and I appreciate it. Thanks so much.
Thank you, Martin, and thank you, Thomasina.
Thanks, Vinay.